everyone, I'm Chrystal Hayes and I'm the Clinical Nutrition Manager. This is the Health and Wellbeing Focus on Nutrition class for Healthy Heights, and today we're going to be talking about the DASH diet and a way to lower your blood pressure. So what is the DASH diet? It stands for Dietary Approaches to Stop Hypertension. The DASH diet is basically eating less salt or sodium and helping to reduce your risk of developing high blood pressure. The diet focuses on eating fruits and vegetables, whole grains, fish, poultry, nuts, and fat-free or low-fat milk products to help lower blood pressure. So why the DASH diet? Well, of course, high blood pressure affects 65 million or 1 in 3 American adults. 28% of American adults age 18 and older have pre-hypertension. So let's talk about kind of a normal blood pressure is considered 120 over 80 or less. If it's 120 to 39 or 80 over 89, we consider that pre-hypertension. And hypertension or high blood pressure is when your reading is 140 or higher and 90 or higher. So the DASH diet, the basics, it basically emphasizes eating fruits and vegetables, and any fruits and vegetables. We don't exclude any kind of fruit and vegetable. Choosing fat-free or low-fat milk and milk products, choosing whole grains, fish, poultry, nuts. You want to choose foods that are low in saturated fat, low in cholesterol, and low in total fat. So you want to reduce your lean red meats. Even though red meats are okay, we want you to choose those red meats less often than you do those white meats. You want to reduce your sweets and added sugars. You want to reduce sugar-containing beverages. You want to choose fruits and vegetables and milk products that are rich in potassium, magnesium, and calcium. And then you want foods that are rich in protein and fiber. So the grains, you want to have about 6 to 8 servings of grains per day. Now a serving size is going to be about 1 slice of bread, 1 ounce of dry cereal, a half a cup of cooked rice, pasta, or cereal. You want to choose whole wheat breads, whole wheat pastas, grits, oatmeal, brown rice, and popcorn as good servings of whole grains. Your vegetables, you want to have 4 to 5 servings of vegetables a day. That would be 1 cup of raw leafy vegetables or a half a cup of cut up raw or cooked vegetables. You want a half a cup of a vegetable juice to be considered as a serving as well. Broccoli, carrots, collards, tomatoes, sweet potatoes, those are all considered good servings of vegetables. Fruit, you also want to have 4 to 5 servings of fruit per day. So you would choose 1 medium-sized piece of fresh fruit, 1/4 of a cup of dried fruit, a half a cup of fresh, frozen, or canned fruit, and a half a cup of fruit juice. Apples, peaches, pineapples, orange juice, berries are all good sources as well. And just remember when you're choosing canned fruits, you want to make sure you're getting a fruit that's canned in juice. Stay away from the ones that say syrup, especially heavy syrup. And you also want to avoid the light syrup. So get the fruits that are canned in its own juice. You want to choose fat-free or low-fat milk and milk products. And you want to have 2 to 3 servings of that per day. So 1 cup of milk or yogurt or 1.5 ounces of cheese to be considered a serving. You want to choose skim or 1% milk, fat-free or low-fat or reduced fat cheese, fat-free or low-fat yogurt. Remember that 2% milk is no better than whole milk. There's only 1 gram of fat difference, so you need to choose the 1% or the skim milk to get the best benefit. Lean meats and poultry and fish, you want to choose 6 or less servings a day. As for the choice there, it's 6 ounces or less. So 1 ounce of cooked meats, poultry, or fish, or 1 egg a day. You want to choose lean cuts of meat. You want to trim the visible fats. You want to broil, roast, or poach, and remove skin from any chicken or turkey that you're going to choose as well. When you cook those foods, you want to make sure, like we said, that you don't fry and you don't add fat to anything that you don't have to. Choosing nuts, seeds, and legumes 4 to 5 times per week is recommended. A half a cup or 1.5 ounces of nuts counts as a serving. 2 tablespoons of peanut butter, 2 tablespoons or a half an ounce of seeds, a half a cup of cooked legumes, which would be dry beans like your white beans, your brown beans, and peas. Almonds, walnuts, kidney beans, lentils, split peas, like we said, the pinto beans, the white beans, those are your good choices there. Fats and oils, you want to limit your fat and oil to 2 to 3 servings per day. So that would be like 1 teaspoon of soft margarine, 1 teaspoon of vegetable oil, 1 tablespoon of mayonnaise, or 2 tablespoons of a salad dressing. Soft margarine, canola oil, low-fat mayonnaise, and light salad dressing are your better options there. Sweets and added sugars, you want to have 5 or less servings of that per week, which would be 1 tablespoon of sugar, 1 tablespoon of jelly or jam, not the reduced sugar versions, but if you're eating the regular version, a half a cup of sherbet or gelatin, and 1 cup of lemonade, because you think about all that sugar that's in that lemonade. Fruit-flavored gelatins, if you're getting the calorie-free versions they're sugar-free. Fruit punch, hard candies, syrup and sugar, you want to avoid those. As much as possible, try to choose sugar-free options instead. So let's talk about the sodium content of some of the common foods. When you look at this screen, you can see, a slice of bread has anywhere from 110 to 175 milligrams of sodium. You want to choose items that have anywhere between 150 to 200 milligrams or less per serving. So if you'll see on there like beans, canned beans, a half a cup has 400 milligrams. You want to stay away from those canned foods because they are high in sodium. If you'll do fresh cooked beans instead, it's a very low amount of sodium included in those. The ham, lean, roasted 3 ounces has 1,000 milligrams or more of sodium in it. So any kind of processed or cured meat or food, anything that comes from a can is going to be pretty high in sodium. If you'll look at your vegetables and get the no added salt version, they have significantly less amounts of sodium included in them. So some tips to help you reduce your sodium. First, you want no salt added foods and condiments. So like we said, low sodium is 140 milligrams or less of sodium per serving. Fresh or frozen vegetables are your best choice. Fresh poultry, fish, and lean meats, salt-free seasonings such as Mrs. Dash, any kind of herb and spices that you can use that do not contain salt are better. Avoid canned, processed, or smoked versions, and avoid adding salt to anything that you're cooking. A good tip is to add vinegar or lemon juice as to fresh vegetables especially. It'll give it a salty flavor to it without adding the sodium. So you want to always ask when you're eating out how foods are prepared. Sometimes they add fat to foods, and you can easily ask them to not add fat to your food, as well as salt. You can ask them not to salt your food. High sodium content terms to look for on a menu are going to be pickled, smoked, or cured. High sodium content condiments are going to be soy sauce, teriyaki sauce, mustard, ketchup, and pickles. Fruits and vegetables as a side instead of salted chips or fries is always a good option as well. And that's it for today. Thank you.